Now in this section we will talk about the chronic meningitis and chronic meningitis especially caused by different bacteria and the viral causes. So common bacterial causes of chronic meningitis and how they present and what are the diagnostic tests for these infections. We have partially treated suppurative meningitis, mononuclear or mixed mononuclear polymorphonuclear cells are present in cerebrospinal fluid. The helpful diagnostic tests, we have cerebrospinal fluid culture and Gram stain is effective. Then the risk factors in systemic manifestations include history consistent with acute bacterial meningitis and incomplete treatment. So in this case, remember the suppurative type of meningitis, partially treated suppurative meningitis, different microorganisms like streptococcus, staphylococcus, different microorganisms, different bacteria cause acute meningitis, and if it is not treated completely and if it is partially treated, it can become chronic meningitis. So there is mononuclear or mixed mononuclear polymorphonuclear cells. CSF culture and Gram stain is important diagnostic test, and their history which is consistent with acute bacterial meningitis and incomplete treatment. Then parameningeal infections, mononuclear or mixed polymorphonuclear mononuclear cells, contrast enhanced CT or MRI to detect parenchymal, subdural, epidural or sinus infection. We have otitis media, pleuropulmonary infection, right to left cardiopulmonary shunt for brain abscess, focal neurologic signs, neck, back, ear or sinus tenderness. So these are the clinical manifestations associated with parameningeal infections. Mycobacterium tuberculosis, another bacteria, mononuclear cells except polymorphonuclear cells in early infection. Commonly less than 500 white blood cell per microliter, low cerebrospinal fluid glucose, high protein. Tuberculin skin test, acid-fast bacilli culture, tuberculosteric acid detection and cerebrospinal fluid. Identified tubercle bacillus on acid-fast stain of cerebrospinal fluid. So acid-fast bacilli is tuberculin, Mycobacterium tuberculosis is acid-fast bacillus, and that's the important test for the diagnosis. Exposure history is present. Previous tuberculous illness, immunosuppressed. If the disease is not treated properly and patient is immunocompromised, they have AIDS or other infections in which immunity is low, usually these patients can have attack of tuberculosis and can cause tuberculous meningitis. And then there usually is night sweats present, miliary tuberculosis on X-ray or liver biopsy, stroke due to arthritis. Then some other causative agents, we have Lyme disease caused by Borrelia burgdorferi, tick bite, mononuclear cells, elevated protein, serum Lyme antibody titer, Western blot confirmation should be done. Previous tuberculous illness, immunocompromised, anti-tumor necrosis factor therapy or AIDS, young children, fever, meningismus, night sweats, miliary tuberculosis. All these are the features present in patients with the Lyme disease. Then syphilis. Syphilis can be secondary, tertiary, or primary syphilis caused by the Treponema pallidum. There are mononuclear cells, elevated protein, CSF, VDRL, serum VDRL, fluorescent treponemal antibody testing, or MHA treponema pallidum, serum VDR may be negative in tertiary syphilis. Individuals are at increased risk of aggressive infection, dementia, cerebral infarction due to endarteritis. So all these are different bacteria that can cause chronic infections, chronic meningitis. Most of these cases are usually, if they are untreated, not properly treated in acute conditions, they can progress and can cause chronic infections. Actinomyces is another bacteria which cause in the cerebrospinal fluid we find polymorphonuclear cells, anaerobic culture, parameningeal abscess or sinus tract, oral or dental focus, and there is also pneumonitis, actinomyces infection. Then we have nocardia, polymorphonuclear, occasionally mononuclear cells, often low glucose. Most of these bacteria, if you notice, these are the one which usually don't cause acute meningitis. They are more associated with chronic infection, not as common, usually affects the individual who already have some other systemic manifestations or who have low immune system, weak immunity. Associated brain abscess may be present. Then we have brucella, mononuclear cells, rarely polymorphonuclear, elevated protein, low glucose. CSF antibody detection, serum antibody detection. Intake of unpasteurized dairy products, exposure to goats, sheep, cows, fever, arthralgia, myalgia, and vertebral osteomyelitis is present. Then we have Whipple's disease caused by Tropherma whipplei, mononuclear cells, biopsy of small bowel or lymph nodes, CSF polymerase chain reaction for Tropherma whipplei, brain and meningeal biopsy with PAS strain and EM examination. Diarrhea, weight loss, arthralgia, fever, dementia, ataxia, paresis, ophthalmoplegia, oculomasticatory myoclone. All these are different features associated with all these different bacteria, and how we can test these and how we can find out that these are the causative microorganisms. Then some viral causes that can cause chronic meningitis. We have mumps, lymphocytic choriomeningitis, LCM, echovirus, HIV, herpes simplex virus. So these are some common viruses that can cause infections. Mumps, mononuclear cells, antibody is present in the serum, no prior mumps or immunization. May produce meningoencephalitis, and besides meningoencephalitis, chronic meningitis, the mumps is also associated with sterility in males because it causes azoospermia and affect the production of the sperms. May persist for 3 to 4 weeks. Lymphocytic choriomeningitis, mononuclear cells, antibody in serum. Contact with rodents or their excreta is associated or is present in the history. May persist for 3 to 4 weeks. Echovirus mononuclear cells may have low glucose. Virus isolation from cerebrospinal fluid. Congenital hypogammaglobulinemia is present. History of recurrent meningitis. Then we have HIV, acute retroviral syndrome. Mononuclear cells, P24 antigen in serum and cerebrospinal fluid, high level of HIV viremia. You can see high level of viremia in the picture, may persist long enough. Chronic meningitis may develop in the late stage. HIV risk factors, there is rash, fever, lymphadenopathy, lymphopenia in the peripheral blood. Herpes simplex virus, mononuclear cell, PCR for herpes simplex virus, CMV DNA. CSF antibody for herpes simplex virus and Epstein-Barr virus due to herpes simplex virus 2, rarely as a result of herpes simplex virus 1. Associated with genital recurrences. So this is due to genital herpes associated with genital recurrences. Epstein-Barr virus associated with myeloradiculopathy. Cytomegalovirus is associated with polyradiculopathy. So that was all about section 3. Thank you for watching sqadia.com.